So when you choose a journal, what should you consider? What kind of factors, impact factor, audience, and so on? So here's where my consulting business comes in. Of course, you create a matrix and a shortlist. You do a list of potential, you do a wide search, you ask people, you list a couple of journals that might be interesting to the manuscript, that you think are interesting to the manuscript. Let's say you come up with 10, that would be too many, you try to cut it down to 4 to 5. That's something that you can handle, that you can realistically look into and really compare one to another. And then you can go on Web of Science or Scopus, and you start pulling out the parameters. What's important here, first of all, is, of course, impact factor and audience. It's already mentioned in the question. Look for the impact factor, might help you down the road. Look for the audience. Do you believe the audience is a good fit? Then you should look at their requirements on the guidelines to authors. Is there anything that you cannot fulfill that's like a criteria that's absolutely a no-go, that you need to bring certain data sets, that you need to bring a certain length or certain shortness of the manuscript and so on? Go through if there's anything that might be an issue, or if there's, for example, a missing ethical declaration and so on, then you would need to choose a different journal. So rank that if there's any no-goes in that. Then you can look at their global reach. So is that a regional journal? Is that a country journal? Is that a continent or global journal? And see if the manuscript that you have has an impact, for example, globally or country level. An example to mention here, if it's an epidemiology study, that's always a good example. Is that an epidemiology study just for the country or for a wider set of countries or even globally? And that determines also if you want to select a global journal or a regional journal. So that's another one, is global reach or geography, regionality. Another one is the applicability across disciplines. So how specialized is that paper that you have there? Is it really a subtopic of a subtopic? An example of anesthesiology for cardiac surgery, that's extremely specialized, because it's really only on a subset of anesthesiology patients in a subset of operations. So that's rather small. Or is it a extremely novel description of a clinical trial across heart disease, for example, that could change the practice of patient treatment? And then it's something like Lancet, one of the large global medical journals that really go towards patient treatment, yes, but also on a global scale where things can be applied anywhere. So think through what can be done there. Next one, importantly, is also the publishing cost. That should not be prohibitory to you. They're always higher than you expect, so check the fine print. But you should have at least an impression of how much it's going to cost. And that includes with extra page charges, extra color figure charges, and so on, that do hide quite a few of the costs in fine print. Check if it's open access or paywall access. Typically, open access is much more expensive as well. And you need these data not necessarily to compare, because if it's a better journal and one paper costs $8,000, the other $6,000, you probably might still take the more expensive one. But you need to be able to present it to your PI or someone to say, this is what it's going to cost us. And you also need to be able to maybe get additional funding for it, maybe from grant funding organizations that have included publishing fees as well in their special budgets within your institution, or also there's a lot of aid programs or support grant programs for different regions, for different countries around the world. So it might be interesting as well to look for that, but you need to know how much it is to ask for the money.